I'm Mandie Moore. I'm a family nurse practitioner and I specialize in the medical management of our bariatric patients. Within our bariatric program here at Texas Tech University, we also offer the medical weight management of obesity. The National Institute of Health has a classification for obese patients. We look at these categories to determine where you're at. Overweight is a BMI of 25 to 29. Obesity class 1 is a BMI of 30 to 34. Obesity class 2 is a BMI of 35 to 39. And our extreme obesity class 3 is a BMI of greater than or equal to 40. How do we determine where you need to be according to your BMI? Based on your BMI, we can decide the best treatment for you. A BMI of 25 to 29, we really want you to work on a healthy lifestyle, making some modifications. A BMI of 30 to 34, we really want to work on healthy lifestyle and possibly adding on some medications. A BMI of 35 to 39, we start looking at lifestyle changes, possibly medications, and surgery if you have risk factors. A BMI of equal than or greater to 40, we recommend surgery. There are many different treatment options that we use in the treatment of bariatric patients. We want to correct underlying medical issues. One of the first things that we do when you come into our clinic is run a full panel of blood work to make sure there's nothing else going on that we need to address before we move on. We start looking at simply just lifestyle modifications. What are you eating on a daily basis? Give me a 24-hour food log. Let's see where we can make some small changes that maybe can add up to some big results. We also start talking about medications. What are some things that maybe we could add either over the counter or prescription that may help curb the appetite, increase energy, and get you going? Another thing we look at is, are you a candidate for surgery? When is the right time to really start having that conversation? There are so many benefits to our patients losing weight. One of the biggest ones is increased energy. You're just going to have energy to do things that you haven't been able to do in a really long time. You regain that self-confidence that's been lost that you thought maybe you never would have again. You also have overall improved health. Many of our patients are able to wean off of and stop completely medications they've been on for a long time, including medications for heart disease, high cholesterol, blood sugar issues, high blood pressure, and thyroid. One of the other things that we've noticed as you lose weight, your body is more rested and you just feel like a new person. Medical weight management for our obese patients depends on a lot of different things. Some of the things we look at is, are you a surgical candidate? Where is your BMI at? Are you just overweight or do you fall into the morbidly obese category? We look at your insurance coverage. Will they pay for surgery? We also look at, what is your history? Have you had bariatric surgery in the past and failed? The other issue is we look at non-compliance. Are there some things that maybe I could help you with along in your journey to get you back into compliance? One of the other issues that we look at and screen for is tobacco use. One of my jobs is to sit down and talk to my patients about modifications that we can make in your life. One of the first things I always recommend is eat less, move more. Find an activity that you enjoy and get out and do that. Eat smaller portions. We're a society that has to feel like we have to clean our plate. We don't have to do that. It's okay not to. Don't always center your family functions and parties around food. Celebrate just being with people. Learn not to be an emotional eater. Find somebody who can be an accountability partner and who can help support you in this journey. Find and set small, attainable goals. Let's look at the big picture and just try to take it one step at a time. Don't get overwhelmed in your journey. If you could, try to eat most meals at home. Too many of my patients are tempted when we eat out. Try to cook small meals at home with your family where you have that social support. I like for you to drink a lot of water. Staying hydrated really helps curb your appetite and helps you to be able to say no to some of your temptations. And also, please get a good night's sleep. When we're well rested, we tend to not make those emotional food choices that can help take us down the wrong path. There are many multiple options that we could use in the medical weight management for obesity. We have some prescription medications. There are also several good over-the-counter medications that may be an option for you. There are some injectable medications as well as medicines that you can take by mouth and powders that you can mix into some of the foods that you're already eating. As with any medication, you do have side effects with all of these medications. Further discussion with your provider will help to decide which medication is right for you. There are so many advantages to doing a medical weight loss program. First off, this diet is safe and the weight comes off a lot faster than probably many of the other diets you've tried. You're supervised by me and my team. We are here to help you along, and we want you to be successful. We sit down with you and make personalized goals. What do we want to see accomplished with you? We help you work on a diet, something that works with you and your family's lifestyle. I also want you to take a daily food log and journal for me. I want to sit down with you and review where we could make small changes that add up to big results. I want to see you every week for a weekly weigh-in. Let's see where you're at. Let's make those small goals that we can touch base with on a daily basis if needed. I'm also going to just give you guidance on where we're at and where I think you need to be going. If I feel like you need to be referred on to see one of our physicians, that's what I will do. Also, I like to send you to one of our support groups that meet on a monthly basis to help you to know that you're not alone in this journey. We're here for you. Thank you so much for watching my video. I look forward to working with you and helping you along your weight loss journey.